feel good. I knew that I wouldn't. I feel good. I knew that I wouldn't. So good, so good. I got you. Wow, I feel nice. A sugar and spice. Hey guys, we're back. Hopefully you can see us. Yeah, I think we're good. So today we're going to go a little bit more into Sean's background. Definitely in frame now. We're going to go into Sean's background and kind of hear what he does a little bit differently, maybe as a physical therapy that differentiates him from other physical therapists in the area. So if you want to take it away and kind of talk about it.
Yeah. I've worked for traditional PT companies before. Started my career I guess I shouldn't give names, but started my career, kind of did the whole cookie cutter run of the mill thing. You come in, you're being seen with 3 or 4 other people, like your PT's running around like a chicken with that head, just barking orders, giving you exercises to do. You find yourself doing the same thing over and over again every time you're there. And you're like, everybody's always asked themselves the same question. After a few weeks, they're like, why am I even coming here? I can do this stuff at home, or I can go to the gym and do this stuff, which is exactly the problem. Like, you're not getting the dosing you need. You're not getting that actual care that you need. They're not putting their hands on you enough. They're not doing the work you need to feel better. So Onward started up in 2019. We opened up, Brady opened up in 2022. He's our owner. And it's just been a game changer. So I came on board a little over 2 years ago now, and I've never looked back. Nice. It's a totally different model. We only do one-on-one. You're never booked with another person. We do a full hour session. It's not a in and out 15-minute quick little checkup thing.
Which, I think it's surprising that so many places still do the old model. You think when people are going in for PT, it's like a clinical treatment. So that's like going into your physician and being like, oh yeah, by the way, I'm with 4 other people in the same like treatment space.
100%. And right. I've had those experiences where I've gone in, like even into a physician's office when you're like, I know there's 6 other people in different rooms right now, and they're just running around, and you feel like you get that like couple minutes, and you're like, what the heck? Mm-hmm. So same thing for traditional PT. Like if you're just doing exercises and then 5 minutes they touch base with you and stretch your ankle or whatever, and then say, okay, see you later. Mm-hmm. Like it's not getting to the root of the problem. You're just doing basic low-level exercises that aren't even challenging you appropriately.
And that's so they don't have to watch you, right?
Right. They give you something nice and easy, bark a few cues, and like most conditions, and this is backed by research, a lot of things resolve with time.
Right.
The average plan of care in a regular PT clinic is months. Right. You were there for such a long time, coming 2 to 3 days a week. You should be getting better substantially faster.
Yeah.
It doesn't need to take that much time, but they're almost playing a little bit of that waiting game. Like, okay, you're going to probably get better. Your back pain's going to clear up in the next 6 months anyway. So I just need you to do something to move.
And it's funny, like you say that. So I had a really, really positive experience with a different PT place. But it was like one of those ones where I had to like kind of take over my own, like after like 4 weeks, like I had ruptured my L2 through my S1. So pretty significant structural damage. But I like after like 3 or 4 weeks, like I was like, dude, I need to like push it. It's funny because now looking at all the things I've learned since then, like after getting out of college, learning, from like Mike Boyle and from other trainers, like I kind of mishmash with everybody I learned from. But like if something doesn't hurt or if it doesn't feel wrong, typically now there are exceptions, but if you're doing the movement properly, typically then you're probably safe to do it. Like for me, it's funny. I always hear people talk smack about a front squat and they're like, oh, it's so bad for your spine. I'm like, dude, that's actually the only one that doesn't bother my back. Now back squats, I've gotten to the point where it doesn't bother it either, but that took a lot more work than a front squat. Like a front squat, I always felt like, because you have to engage your core in order to hold that weight properly. But that was something I hopped into pretty quick. But yeah, I'm sorry. That was all to agree with you.
And I agree. I think we have the biggest issue is it's an underloading, underdosing problem. We don't do that enough as PTs. Like you're afraid to give people heavy lifting to do. And that's where that disconnect is. We talked about this last time, like where the transition from PT to strength training goes. People don't do it enough, and they're not equipped enough. Like you go into a clinic and you see TheraBands strapped to a wall and then dumbbells that go up to 10 pounds. You're like, okay, that's as far as I can go from literally here. That's all you're able to do for me. You walk into our clinic, we've got a squat rack and a barbell. We've got 400 pounds worth of weight. We've got everything that
which you're trying to upgrade.
Which I want to bring more in, because if I treat some very, very strong power lifters, and if their back doesn't hurt when they deadlift 400, but their back hurts when they deadlift 6,
you need to see where that breakdown is.
I need to see the breakdown in the form. And now I guess, I have no problem doing stuff remotely too, where I'm like, do that in the gym, take a video of it, and let's break it down.
But it's always better when you can be hands-on.
100%. And then you can address it immediately. I can make those cues in real time. I can have them come into the room and say, all right, let's hit like some good soft tissue work. Let's get you loosened up. Let's figure out what the problem is. Then go do it again and see if that immediate release happens.
And they can see what an optimal session would look like, right? You hit the soft tissue work beforehand and they feel, okay, this is what it should feel like when I'm doing it. So then that might also, make them like, okay, maybe I should do that like soft tissue work before I start my lifting.
For sure. And it's the test retest model. We're huge on that. Like I'm never going to just throw darts blind at a board. You come in, we do a nice thorough evaluation. And it's interesting to have the time to do that. In my previous jobs, you were like, you're in and out. You're trying to get through as much as you can do, where you're not really deep diving into looking at people. And there's so many things you can do when you have the time to do it, which is why I love that hour. I love being dialed in with just like one person. So for example, guy comes in, he's got pain in his shoulders with overhead squats. Naturally, you go and take a look at the shoulders. I can treat those shoulders until the cows come home. But if there's nothing wrong with the actual shoulder, it's just irritated by the movement. Now I got to figure out why. Could be something as simple as ankle mobility. So they have restricted ankle mobility. Their torso is forward leaning now more than it should be. So now there's unnecessary stress through the shoulder to correct the position. If I treat, the thoracic spine to open up shoulder mobility, treat the shoulders to open up that stuff, that's great to help with that. But if your problem is stemming from your ankle mobility through that movement, I can treat your back and your shoulders all day long, but it's going to continue to hurt because you're not fixing the root problem of that movement. So having the time to really sit down with somebody and go through that kind of stuff and do more of a thorough evaluation where I'm allowed to look at your ankles for starters. Because that's the other problem is if you come into a regular clinic with a script for shoulder pain, legally they're looking at your shoulder and that's it. They have to fudge the system to try to figure out why.
Because they're not looking at the movement. They're looking at, okay, your shoulder hurts.
And that's we're a specialty clinic. We're out of network. We don't have ties with insurance companies. With those ones, they have to abide by what the insurance company approves. So if they have a script for shoulder pain, they're looking at your shoulder. Most of them aren't even going to take that next step to look at the other things because they're not supposed to.
And it's funny because it's almost never that actual, like, unless there's like a tear or something, it's almost never actually that joint, I've learned, right?
It is so interesting to see how stuff plays into it.
Because it's all like, this was a cool concept I was learning, like we talked about it before in person, like the stack of joints where like it literally can stem, like you were just saying, like your ankle mobility can affect your shoulders because it's all the structural integrity of the joint below or the joint above affects the joint that's either right above or below, and it works its way up the chain. Because if there's 100%. A disconnect here, it can work its way all the way up. Now, typically, this was something that I thought was a cool visual for it. Was like you see that all the time with like basketball players. They're typically having their ankles taped up, and then they wonder why their knees, like they're blowing their ACLs, and it's like, well, because your ankle's meant to be like a mobility. It's meant to move, a mobilizer, and your knee is meant to go out and in. That's it. Not much to the side, like not planted to the side. It's not supposed to be doing all that. So then when you're forcing your knee now to try to make up some of the mobility you're losing by taping your ankle, now you're just asking for an injury.
100%. We need to address the whole person. You can't just look at the injury. You can't look at like an image. If somebody comes in and shows me their MRI, I'm more than happy to look at it, but I need to see you as a whole. I can't just see this is the picture and this is what a textbook says I should do. You need to really get into the nitty gritty of analyzing that whole person and what they're doing. Talk about their training, talk about their nutrition, talk about their sleep. There are all other things that can be addressed to take the whole picture, to get to the root cause.
Right.
Now it's my job to figure that stuff out. And we always say, take the guesswork out.
Mm-hmm.
I need all of those factors, but I also need to figure out what the root cause is.
Right.
So we need to kind of get past everything and say, hey, here's what's causing what.
Yeah.
Put the fire out, settle things down, and then let's find ways to adapt and get you back in the gym doing what you need to do.
Right.
I'm not going to tell you, okay, stop going to the gym for the next 6 weeks. That's not going to help you. That's not going to help anybody.
Do you think part of that? So I was just thinking while you're talking about that is like, almost like when you have 4 people, it's really hard to, like, if you're not meeting with them one-on-one, like for when I went in, for example, you and I, and this is something I do with all my clients, I may have group sessions, but every single person in here is going to get like a half-hour, meeting their first 3 within their first week. And we do that quarterly to make sure we're working towards our goals. But really, it's like an education piece there, right? And when you get that half hour with someone, you're able to get a full deep dive versus like these offices, they don't really get to know you. So I feel like they almost think, all right, I don't have enough time to educate this person, so I'm just going to keep them longer because it's the only exercise they're going to do because I'm pretty sure they're not going to go to the gym. But I feel like that's a breakdown in just not educating them how important going to the gym is after treatment.
Absolutely.
Because it's just easier to just say, I'll just stay here.
Absolutely.
If their insurance is only charging them $12 a session or whatever, right?
Right. So then, open up a whole new can of worms. Is there is more of that like liability on our side where people are paying to come see you. They're spending a lot of time with you. They feel that obligation now where they're like, I need to do what you're telling me to do. Like, I want to take this seriously. They're not coming to you if they're like, I don't really care and I don't want to deal with this. Like they're
not going to find, because they have to find you.
Right. So most of the people that come to see us, I will say, are a little bit more invested from that standpoint, which is great.
Yeah.
We work with a more athletic population, people who are already involved in a gym, which is great. I'm not trying to take them away from that gym. I want them to stay in the gym.
Right.
I'm not seeing you 3-4 times a week. I'm seeing you maybe once a week in the acute phase to get things settled down where we can make those subtle changes to, okay, maybe you can't lift off the floor. Maybe we got to start with a rack pull. I can make those suggestions, talk to the trainers, like communicate with you about some of the people in here. Like that's that step. My goal is let's do the stuff you can't do on your own. And then I'm going to send you off to do that stuff that I want you to do and the other stuff you're doing.
Yeah.
Go hit your workouts. Hit maybe that 1 or 2 more bang for your buck rehab exercise, but let me do the stuff that you're paying me to do.
Right.
Soft tissue work. We do a lot of cupping, a lot of dry needling, spinal manipulation. It's a lot of that hands-on stuff because that's what you can't do.
Yeah.
You can't just go into the gym and say, okay, I'm going to crack my own back. I'm going to, needle my leg. I'm going to like reduce inflammation.
Please don't.
Please don't do that. Like, let me do the stuff that I was trained to do that you can't do. Yeah. And then I'm going to make a few subtle suggestions and say, hey, this stuff is really going to be, take 5 minutes, dial this in for me and keep hitting the gym.
Right.
Go get your exercising, get stronger, get fitter, become a better human overall. And I like that mentality where it's not, okay, come in and let me watch you work out for an hour.
Right.
Where I'm barely even watching you.
Yeah.
It's just not as efficient.
Well, and also, this was when I kind of knew, like, I may or may not have terminated my PT early each time with my previous one. I got a lot of use out of the first, 3 or 4 weeks. And then, there was the point where I started coming in and I knew exactly what exercises they wanted me to do. And I was like, all right, well, if this hasn't changed at all as my back's gotten better, then it probably means, I'm good to go. Just do what I need to do to progress it from here on my, knowing what I know. Now, obviously, not everyone's going to have that experience. I think that's a really cool philosophy with you guys. It's really about improvement, right? There's no holding someone back there, which I think sometimes people are. It's easy because no one's at risk. If they're not going to the gym, they're not at risk because you said nothing to them, right? To put them at risk, which realistically, maybe right now, someone's in their 40s and 50s, you're probably going to be okay. Probably. Yeah. For the next 20, 30 years. And then you're going to be like, oh, why does everything feel so weak? Or why do I have so much pain? And it's like, well, you decided not to do anything 20, 30 years ago.
Right.
But don't let that discourage you. I think my favorite quote it's related to lifting now is, the best time to plant a tree was 20 years ago and second best time is now, right?
100%. 100%. I think we might have talked about this study last time we were together too. Was they took two groups. Like you have people with back pain, and one group did exercise, is what they called it, and then the other group did heavy lifting. And you go back and forth and you look at those, and at a year marker, if you're looking exclusively at pain, both groups were improved. They felt better. They didn't have as much back pain. But if you look at them as humans, group one did seated body weight knee extensions, sit to stands, which I guess you could say is like a squat out of a chair. Group two did heavy 5x5 deadlifts. You know, group two has no back pain, but now they can also pick up their body weight off the floor. They can deadlift 200, 300 pounds. Group one can barely pick up a case of water off the floor. Those are not the same. And yes, if you're solely focused on pain, first off, you had to wait a whole year, which is just an insanely long time to deal with back pain. But two, like, you're not the same. They are not even groups, in my opinion. And if you're going strictly off of a nominal pain number of 0 to 10, sure, you're even. But if I have somebody who's a stronger, fitter, better overall human being now, that substantially outweighs group one.
And chances of them coming back to you are a lot lower, or they're going to come back to you only for the soft tissue treatment. Like what I've done, I need to get back in, but both of our schedules suck. But I need to get back in, and like that was like super helpful for me, because then, you know, I just continue to do what we had talked about, like working on the grip exercises for my elbow. And it's like, it's funny, like even for someone who writes their programming, I'm like, shoot, you're right. I got to include more of my like farmer's carries and all that stuff just to maintain it after I get it feeling better. Right. And
for sure.
It's just one of those things where, you know, I feel like that's one of the missing pieces. I feel like we almost like do a disservice in a lot of like places where it's almost like people step on each other's toes a little bit with like, I feel like I hear a common one that I hear in here that's probably similar to something you hear is like my physician told me I should eat this. And I'm like, all right, dude, I went to 5 years of nutrition and biomed and biochem classes to tell you what you should be eating. But your physician who did 3 classes in med school knows significantly more than me. Yes.
I will not speak too illy of that, but yes, I hear it all the time where, I was told I should never deadlift again because it's bad for
my back. That's a huge one in here.
Or like, oh no, I shouldn't run ever again because it's bad for my knees.
Lately it's been squats for me. I had someone come in recently and they said like that their doctor had told them, squats are going to be what causes your back pain. It's like, the squat itself is a movement pattern every human should be able to do.
100%.
Outside of certain factors, of course, but like every human that can move should be able to perform a squat of some sort.
I totally agree. And I won't go too deep down the rabbit hole with this one, but there's definitely a disconnect.
Yeah.
You have people step on each other's toes, you get miscommunications, you get different advice everywhere you look, and it is hard to kind of sift through everything and find out what's right. But I agree. And I tell people this all the time. It's not that you have to do it.
Right.
I will never tell anybody they have to do anything. Yep. You don't have to heavy back squat.
No.
You don't have to heavy deadlift.
Yep.
It's having the ability to do the movement pattern or to do the things you want to do that's important.
Yes.
So I will have people where they're like, I've never done a comfortable squat.
Yeah.
Okay. I don't need you to start squatting double your body weight. I'm not going to say that that's a goal you need to have for yourself, but I want you to be able to have the ability.
You should be able to stand up properly from a squatting position.
Correct.
Yeah.
And like I have people that I don't want to run. Like I have somebody who had a fairly significant knee surgery. Mm-hmm. She's like, I have no desire to run. I don't want to do it anymore. I'm never going to make you do that, but I want you physically to feel confident in the fact that you could run 30 seconds.
Yep.
We're crossing the street, lights turning red.
Across.
You need to hustle up a little bit.
Yep.
I just want you to physically be able to do it and feel confident in the fact that I could pick up the pace a little bit. Yep. And that's where I leave it with you. You don't have to go run a marathon.
100%.
Totally fine. But the bare minimum, you should feel the confidence in yourself to say, physically, I know I can run from A to B, or I can get up out of a chair. I can get up off the toilet. I can do a squat. I can pick this case of water up.
Yep.
I can pick my grandkid up. I can get milk off the top shelf of the fridge. You should be able to do that stuff and just feel good and confident.
Yeah.
And that's something I want to instill in people. And if they want to go further, heck yeah, I want them to be in there with you 5 days and be like, let's get after it.
Yeah.
One thing that I think that we have that is super, super cool that I've never had access to before is that to close that disconnect.
Mhm.
My first job, I used to discharge people when they were quote unquote by the insurance company at their prior level of function.
Mhm.
That's where things were cut off. You are now able to do that very, very bare minimum of stuff. And now good luck. Maybe they go to the gym, maybe they don't. I wasn't allowed to do anything about that. Now we have a program where we'll see people on like a monthly maintenance wellness preventative basis. You come in, get a tune-up. That's it. You're hitting the gym. I tell people the sweet spot for me is every other month you should be complaining to me about something, because it means you are adequately progressing yourself, and then you see me to stop that tiny little nagging injury of becoming this massive thing.
Right. Yep.
I don't expect everybody to feel 100% comfortable all the time. You're hitting the gym hard. You're pushing yourself. Maybe my like glute feels a little tweaked, or maybe my back feels a little sore after I really push deadlifts. It's nothing that you should be afraid of. We just learn how to cope with it and how to fix it. So you come in, you get a quick tune-up, and whether that just be like, I have people that come in for back stuff where they're like, I literally just need some good soft tissue work, throw some cups on it, let's stretch it out, let's do a little dry needling, flush out a lot of the inflammation, hit the reset button, and they're good. Then they go back to their training and they have no issues. And they're like, cool, I'll see you again next month. And if it's feeling great, awesome. If it's not, tip another tune-up. You don't need to constantly go through the cycle. Now I need to be back in PT 3 times a week, or now I need to come see you every single week. No, come see me once a month. Come see me every 2 weeks if you want. I don't really care. It's whatever you feel like you need. Let's keep you moving. The whole purpose of this program was designed for people to stay in the gym, push themselves hard without fear, because you have basically a PT on call that as soon as you use that session anytime you want through the month, and like just come in and get the tune-up work and keep killing it, like keep crushing it in the gym.
I agree. And it also takes that and it's something I've been thinking about a lot here, is like people feel like they need to graduate from being coached or graduate from PT, and it's like there's no graduating. Like every high level athlete I know, I have coaches. I have like 6 for like all my MMA stuff. I am always learning from other people, because I know I'm not the best at every single thing I'm doing, then I should be taking advice from someone else. And we were just talking about it for your powerlifting event. You had your own coach, and it's like everyone that is an elite athlete or lower, like if an elite athlete has a coach, you should probably have a coach if you're not there too.
Like the Olympic weightlifting teams, they all have coaches. They're the best lifters in the world. They still have somebody who coaches them, breaks down their form, takes care of them afterwards. Like it is super important, and you don't have think of it like your car. You don't just wait until something breaks on your car. You take it for routine oil changes. You fill it with gas. You take it to the car wash. You take care of it over time so that it doesn't become a catastrophic event. So why wouldn't you do the same for your own body? Go to the gym, work out a couple days a week, take care of it so that in 50 years, you're still feeling strong and resilient. And along the way, get your tune-ups done. Go in, stay feeling good. That's why I always, like I said, with the every other month thing, if I see you in a month and you're like, I feel really good, great.
I'll see you next
That's
month.
why. See you next month. And if something's not feeling great, let's make sure that we fix that up. But let's keep things feeling good. And there's always something you can work on with people, whether it be a simple mobility restriction or like a small little subtle, like, okay, I know at the gym I got a block coming up where I'm going to be doing a lot more overhead lifting. Sweet. Let's see how your thoracic spine moves. Let's see how your shoulder mobility is. They look good. Awesome. Here's a couple drills to keep it that way. Or, okay, mild rotator cuff strength deficit. Maybe tune that up, because if you're going to really be pressing hard, we want that feeling better.
Absolutely.
So,
all right, Sean.
Sorry, I'm getting
thank
my
you.
soapbox.